I'm Michael Shea in Arlington County.
And I'm Dr. Makunda Abdul-Mbacke from Henry County.
Thank you for joining us. This is
Behind the Mask.
So Dr. Mbacke, what impact has the pandemic had on the ability of people in your community to get health care?
Right now, as we're filming this, we're in the middle of the surge. I don't know if it's the third wave, the fourth wave, but it is the end of September 2021, and we're in a space in this country and in this county that we didn't think, or I should say I didn't think we'd be in, because things looked so promising earlier in the year, April, May, even up to June. It looked like we were going to really beat COVID, that we were going to get vaccinated, and that life was going to get back to normal. How wrong we were with the fact that there was this large percentage of people in America who politicized vaccines and made it a democratic liberal issue as opposed to an issue with science. So, as it stands now, we still have almost probably a little bit less than a third of the country that hasn't been vaccinated. So what we're seeing now in Henry County, every day there are deaths from COVID-19, and we really did go through a time in May and June where there were no deaths. So we're seeing deaths, we're seeing illnesses in youth, we're seeing deaths in younger people, 30 and 40 years old. We are being told by our local ambulance service that they are going to have to triage people who call. So if it's deemed non-urgent, you will be told to go see your primary care doctor in the morning, or go to an urgent care center, because we don't have the people power to go out to pick everybody up. Now, obviously, if they deem that you're in an emergency situation, they will come and get you. But it's, I've been practicing, medicine for more than 20 years, and I've never really heard them say, like, we're going to have to triage the call. Not to say that everyone who calls for an ambulance needs one, but the facts are that it's going to be harder to get ambulance service. It's harder to get seen in the emergency room. The same thing is happening there. They're trying to do their best to triage and trying to take care of the sickest people first. And so that means that some things are neglected, and the healthcare workers are just overcome with the amount of COVID and sickness and illness that we're seeing. So it's becoming a definite situation where care has to be rationed, because there is no unending amount of care that can be given. The number of doctors are finite. The number of nurses are finite. The number of rooms are finite. The number of ventilators are finite. So there is no situation where there are infinite resources available for everyone. So we are at a space right now in this country and in this county where we are rationing healthcare and basically treading water and doing the best that we can.
Well, Dr. Mbacke, I want to thank you and your team for all the hard work you do in serving your community and providing them with health care, and I wish you continued success.
You're welcome. Thank you for interviewing me.